Good evening, all. Welcome to the third session of CBME in Physiology. First session was taken by Dr. Rasmi Vyas, ma'am, keynote address. Second was just introduction of group and what work you are going to do and division of the group. And now third, and we can see this is the actually first session, that explanation of competency table as well as how to from SLO. But let me clarify some questions which are frequently coming in WhatsApp group. So there are few announcement. Are you able to hear me?
Yes, sir.
Okay. So there are few announcement as well as few things to clarify. Number one, as now with public demand, we can say that our both group are WhatsApp group are only for CBME, and we have created one more group that is CBME social. So other things can be shared there. Next, there are confusion regarding submission of your assignment. So I have shared with all of you in all the group this presentation of this only 4 slide. So what we want to do is you start preparing this. All the presentation will be done only after all sessions of resource person are over. But why we are sharing this 4 slide of presentation? Now within 1 or 2 days, I will again share other few slides. So to progress your presentation, so at the end you don't have to prepare whole presentation. As in when session is finished, you can prepare the you can progress your presentation. And this first few slides we would like to know regarding our history, our scientist, and that's why you can do that. And after that you can have a brief introduction of all the members including moderators. So this is one thing which you are going to do throughout the course. Second thing, once the presentation is over, once your presentation is over, we have also shared with you this Excel sheet, isn't it, which has a number of competency detail, sessions, SLO, their domain level. So these, as sessions progress, we will able to materialize all these things. So once your presentation is over of your group, you are going to get feedback from other group, from other people. Once everything is done, your presentation is done, and you have included the feedback, you will include your competency and your SLO in this Excel sheet. Okay, so at the end of today's session we will again take questions if any. Okay, so these two work we have to do. I will at the end of this session again take questions regarding this, and also we will have a questions regarding today's session. So without wasting much time, let's start our today's session. So today we have a 4 faculty with us: Dr. Niraj Mahajan, Dr. Hasmukh Shah, Dr. Mathangi Damal, and Dr. Swapnil Parlikar. So we are starting with the first part taken by Dr. Niraj Mahajan and Dr. Hasmukh Shah. Dr. Niraj Mahajan has already shared with you a audio, 2 audio, so that you all have gone through it, and now you can just correlate that presentation with our today's session. So over to you, Dr. Niraj Mahajan and Dr. Hasmukh Shah. Thank you very much. Dr. Niraj, you can start now.
Okay. First of all, it will be started by me. I'm Dr. Hasmukh Shah. Good evening to all. I'm Professor and Head of Department of Physiology, Pramukh Swami Medical College, Karamsad, Gujarat. And today I'm privileged to speak here in front of you. For that, I want to say thank you to Dr. Chinmay Shah, Dr. Sanjay Bedi sir. And this is today one of the great moments in my life, because today I'm going to deliver lecture along with my teacher, my guru, Dr. Niraj Mahajan sir. So Dr. Niraj Mahajan sir is Associate Professor, co-convener at Department of Physiology, NHL Medical College, Ahmedabad. He was Assistant Professor at NHL and I was the resident. So I learned a lot of things from him. So it is really great moment for me. So today we are going to deliver introduction of the CBME and introduction of the Competency Table. So there are Three learning objective: introduction to competency-based medical education. Number one, competency. Second one, describe how subject-specific competency are arrived or derived. Third one, describe the all 11 heading of the MCI competency table. So your first objective will be delivered by me, by Dr. Hasmukh Shah. Second and third objective will be delivered by the Dr. Neeraj Mahajan sir. So first of all you are aware about this thing. What is CBME? All you went through the basic medical education workshop, CISP, competency implementation support program. So you all of you know very well what is competency, but let's be revise. So CBME is outcome based oriented or approach to design, implementation, assessment and evaluation of the medical education program using an organized framework of the competency. So look here, this is the outcome based approach, or we can say the result based approach. So our word, mainly medical education nowadays, we are talking about the results. In all professional words, it is result oriented or the outcome based oriented. So here for the result. So main our result is Indian medical graduate. We'll see in next few slides. So we want Indian medical graduate of particular type or with the few professional values or characteristic. So for that we have to design our curriculum. So you have first of all designation of the curriculum, then implementation of the curriculum. So here in this slide you can see the Mahendra Singh Dhoni. Okay, to win the World Cup, we have to frame one particular team. The team with the so many characteristics. Second, for medical professional. Look here in one diagram, the surgeons are doing operation. In second diagram, the clinician or same surgeon is examining the patient. So here he is doing the surgery as well as he is teaching his student. So here CBME, as we say, it is the result oriented or the outcome based education or the outcome oriented education. So CBME, I said it is equal to the OBE, outcome based education. So CBME is equal to the out based education, or we can say the result based education. So hereby there is need to introduce and then implement new CBME curriculum, because we witness, okay, we all are faculty, so here we went through the traditional curriculum. So here there are so many good things about the traditional curriculum, as well as there are few limitations of the traditional curriculum. So here in traditional curriculum, so mainly it was focused on the assessment, final assessment. Okay, we were worried about the certification, only degrees, not the result or not the process. Okay, just only the outcome. And that outcome is not good. So just only result. How it came, we were not worried about that things. So here in new CBME model, so here first of all the healthcare needs or what are the demands of the students, graduate, Indian medical graduate, as well as our community, mainly on the basis of our disease. So we have framed the curriculum on the basis of the disease as well as demand of the Indian medical graduate, as well as how the Indian medical professional is going to deliver his or her skill to the patient. So here for that we have developed the various competencies, and this competency, each and every competencies will be assessed individually. So here our new curriculum is based on this thing. So here previously our curriculum was the content based, right now it is the outcome based or the result based. So here previously in traditional curriculum, just only knowledge acquisition was main thing, and for the faculty just only knowledge transfer, and I use the word here mass knowledge transfer, not only knowledge transfer, mass knowledge transfer. You are going to transfer the knowledge for to the 150 to 250 students. Now here in competency based knowledge application, how we can see here the knowledge application, because right now we have introduced the certification of the few competency. So here we are going to certify the each and every student. So here there is the one of the best part of this curriculum is the knowledge application as well as assessment and evaluation of the student. So here now we think just only one or two line about the assessment. Here in the traditional there was the subjective assessment on measures. Right now here there are multiple objective for the assessment, and assessment tool was the proxy traditional, here the authentic. Okay, we went through so many, we are going to so many tools, or we are going to apply the authentic tool, because here in competency based there are direct observation like the OSPE, as well as by giving the certification. So here we are going to directly observe, and in traditional curriculum it was not specific. Okay, we are going to do only summative assessment. So here in traditional, our main focus on the non-reference based. Here right now in competency, that is the criterion based reference. So here in this traditional curriculum, as I told you, summative assessment was the main focus. Just final degree was given on the basis of the one last exam. But right now, you have to go through the exam at the each and every stage. So this is mainly based on the formative exam or the formative assessment. So now there is one question in our mind: what is the competency? We are talking about so much about the competency-based medical education, CBME. So competency, as it is the outcome or the result-based education or new education approach. So a competency means competent. It comes derived from the word competent. So here competency means it is an observable ability or measurable ability of the health professional or the medical graduates, and integrating the multiple components, mainly knowledge, skill, values, and attitude. So here competency means one of the measurable or the observable ability of the health professional. Now competent, the person or the medical graduate or the medical professional who is able to possessing the required abilities in all domains in certain context at the different stage of the medical education or the practice. So here possessing the required ability or is able to deliver all competencies successfully at the end, after the end of the internship, without any observation. Now competence, the competence entail the more than the possession of the knowledge, not only knowledge. Okay, here knowledge plus skill plus attitude. So here professional, medical professional is able to apply the knowledge as well as able to apply the this clinical thinking, their analytical clinical thinking to achieve the optimal or the good result. Now competently, so your competency means the things they need to do. Competent, they can do all the things. Competence does all the things consistently. So look here, the word consistently is really very good word for the medical professional, because one student in traditional curriculum, there were long questions were asked. He is knowing one question but not knowing the other questions. So here, what we want the consistent approach as the our test player. So here we want the consistent approach to adopt the new thing, mainly for the contextual and the situational need of the our patient. So now on the basis of these things, how Mr. XYZ is going to drive a car. So here competency, he is aware about the accelerator as well as brake smoothly. He can approach the brake, accelerator, and interconnect this thing on the needs of the road. Maybe he's going to turn on the left side, right side, and you're competent. He passes through the education classes, your driver's education classes. Here he get the license. Okay, at the end he will get the license, and then he's able to drive. Now competence, he drives the vehicle safely on the road during any type of the weather. During bad weather, avoid accident, avoid the traffic hurdles. So here he got the keys from his father, and now he can drive the vehicle very smoothly. So here in this way, CBME is one type of new shift, correct? So we must know trainees has demonstrated the competence and is ready to progress the next stage of this career. The next 2 points will be clear or introduced by the Mahajansus. So that's why here it is written in very small so font. So here it requires the clear definition of the expected competency, their outcome, and it is mainly based on the assessment. So look here for the proper delivery of the competency-based curriculum. Here two pictures are shown. One is cricket team, second one is the football team. Look here in the cricket team. So there are so many questions from the faculties that the staff faculty ratio is very less, and we have to deliver this competency-based curriculum. Though we are agree that we have number of faculties are very less and we have too much workload. So here we have to arrange in such a way that we can deliver effectively. So here this is the position of the team player. Here we have to think about we are the faculty. So here for during the introduction of the early clinical exposure as well as various component of the adult learning, we have to work as a team. Here we have to forget our designation, a professor, associate professor, AP or resident or tutor. We have to forget that thing and we have to stand in such a manner that we are going to deliver effectively. Because look here, batsman is going to hit the ball in any direction. We do not know. So your question from the students or the problems from the students come from any direction. So that's why we have to prepare from which side of ball will come. Same way in the cricket team as well as in the football team. So here, this diagram is showing that we have to work in a team. If one is not working, look here, this is the sea and we are sailing the our boat. If you are not, one person is not working, look here, out of this one, we are not going to effectively deliver or we do not going to be sure. Okay, so here we engage or we caught up in ourselves in the mid of the sea. So that's why here we have to work in the team with the proper spirit. At this stage, I end my talk here, my part here, and I invite my teacher, my guru, Dr. Neeraj Mahasan, sir. I welcome Dr. Neeraj, sir.
Namaste to all. I am Dr. Neeraj, and thanks Dr. Hasmukh, Dr. Chinmay, Dr. Bedi. So I am here to cover remaining two uh, objectives, but because we are four speakers today, and then the idea came is that will each and every of the speaker will get enough time or not. So that's why we thought of blended learning, and actually this objective, for this objective I have put two audio clips to cover it. Already it must be not new for you, and so that we can focus on the major objective of today, that is competency table. But even the competency table, you will find is that many things they are repetition, or they are what we are already doing. So let's start with objective number 2. And as we have done, in fact this happens in every field, all set their goal first. This was somehow not in MBBS so clearly. So now we have set our goal in form of competent IMG. So outcome is decided first. For that outcome, 5 roles were decided. If you remember, we have done like P1, C2, L4. Anyway, these are 5 roles to address that goal. Only clinician is not enough. Other things, or leader or professional or communicator, all is needed. For example, Dhoni is coming again and again because he's just retired. So all Dhoni fans, they are remembering it. I also remember a quote is that we should not be sad that he has retired. We should be happy that it happened. So for the World Cup, possibly it's not just his batting. He might have played multiple roles well, including leader, including communicator. So same way for competent IMG, many roles are needed. But how to teach and assess these roles? इन रोल्स को हम कैसे पढ़ाएं, कैसे असेस करें? सो वी हैव टू ब्रेक डाउन इट फर्दर. So we have broken down it further. This was mnemonic into 35 global competency. Out of this 35 global competency, clinician global competencies are 15, and still they are end of MBBS competencies in our subject specific scenario, too big to be taught collectively by us. Maybe in the USA, maybe in the European countries, integrated teaching is so much that they might be teaching like this. But in India, our strength, maybe our, some say it is weakness, but it is our strength also that we are having very good subject experts. So can we carry this global competency into our subject specificity? That is was a very unique challenge, but then it happened, and subject or global competency were further broken down into subject specific competencies. So from each and every subject, subject experts we are collected. As we are from physiology department, in physiology possibly 3 or 4, I think 3 subject experts, they took and or look at global competencies, and on their basis they derived subject specific competencies. And it's also a proud that actually, Dr. Hasmukh is in my home at present beside me. So one of the subject experts who designed the subject specific competency is also Dr. Hasmukh. So this was being done. As Dr. Tejinder Singh says, is that one way to revise very effectively is in question answer format. So I think if we are answering these 5 questions, everything we need will be revised. For example, what is competency based medical education? It is outcome based medical education in which list of competency play most pivotal role. What is the goal? Competent IMG. What is the roles? 5 roles. And for 5 roles we have designed subject specific competencies, and finally we designed ADCOM competencies for all other roles. I have taken this very fast on the basis that audio clips have already covered this. So I want to come rapidly to our main objective today, that is 11 headings, in fact 10 hai, but if we include, we cannot leave objectives from that table. So including objective, we are having 11 components in MCI competency table. So let's have a look how this table look like. So this table look like this. The font may be small, but we are having these all headings of competency table. So I will come back to these headings. What we need to do is that already subject specific competencies are made. Now what we need to do, and for each and every competency, as you can see, every heading or column is also filled. So MCI Academic Committee has done this for us as far as subject specific competency is concerned. What we need to do now, on the basis of subject specific competency, we are supposed to design objective, and from we are having subject specific competency, we are not having global competency. Possibly in the global competency we will have all the domains, but as we are dealing with subject specific competency, possibly practically we should consider it as sub competency. So in many competency we may not find all the domains. We may find just one domain or 2 domains. Normally it is said is that the competency is having all the 3 domains. But in our unique case, in Indian scenario, we are dealing with subject specific competencies, which are a small part of global competencies. So many competency may have just 1 or 2 domain. What I want to emphasize is that we need to fill this table for each and every SLO. MCI has done it for sub-competencies, but we need to derive objectives from sub-competencies, and we need to fill all these columns for each and every objective. So what is these headings? This is how these subject-specific competencies have derived, which we have just learned. So basically, if we go back, whatever medical education workshop you might have attended, even before, this was before CBME being launched, it is always having some table and many headings are actually seen. For example, in any workshop, we used to have some topic, you used to give us some topic and we used to derive objectives from those topics, and then what is the domain of that objective. We are having three domains. One we used to call cognitive, now we are saying it knowledge. So one domain is knowledge domain. Normally we take theory lecture for that. One domain is what we used to call, still we call psychomotor. Now we are using a lot of time a word skill. So other domain is skill, and then third domain is affective. But nowadays we are calling it com, and we are writing as AC. So for any objective, whatever we will make on the basis of subcompetency, we will select first domain, whether it is of knowledge domain or skill domain or atcom domain. So that way we can write KS or AC respectively. Next heading is competency level. So any competency is having basically four levels. So first level is know, just in the theory part or theories of objective. If we are using the word name or enumerate, only recall is involved, only knowledge part is involved, then that competency or objective is of K level. This is as per Miller's pyramid. But when knowledge application comes, suppose we are using the word describe or compare and contrast or why or how, then it is application of knowledge and competency level becomes know how. In the practical, uh, student is supposed to show something. So this level is show how. Highest level of show how for most important practical is performance level P. And in Miller's pyramid, the highest level is always does, but does is basically to perform that competency independently without observation in the field, say when he is practicing, so that we cannot assess. So we can only teach up to show how, or we can say highest level of show how, that is performance. And we hope that he will do that competency, he or she will perform that competency well in society. If somebody is performing that or doing that competency well in the society, this is called does level. So does level we cannot assess, so we come only up to show how or P level. Then if it is objective is a must know area, then it is a core topic, but some part they are nice to, maybe nice to know but not must, then we call it is non-core. So in this column for each and every objective we will write yes or no. If it is objective is must know, why? If it is not must know, then it is we will write N, of course. Then this topic is today's next topic, to derive SLO from sub-competencies. So this Dr. Swapnil and Madam will take, and for each and every objective, we will align appropriate teaching learning method. For example, if it is a ATCOM objective, then just lecturing may not be enough. We have to give some form of immersion or experiential learning, maybe role play, maybe video clip. So as per objective, appropriate teaching learning is selected, and that's why it is desirable, it is needed to divide competency into objective, because any competency may have one knowledge objective, may have one ATCOM objective. For knowledge objective, theory class, interactive lecture may be good enough. But for ATCOM part, only lecture may not be good enough. We have to search for appropriate teaching learning method, and same thing for assessment method. So look, many, almost out of 11, if you see, about 8 headings are actually we have learned. We know that we are having any topic, we are having, or we have to derive objectives. For any objective, we select the domain out of knowledge, skill, and ATCOM. Competency level out of know-how, show-how, and nowadays, if the practical is very important, performance, we have to select whether it is core or non-core, and we select which is appropriate teaching learning method and which is appropriate assessment method. So what is then new? These all are even in the basic workshop, maybe 8 or 10 or 15 years before, all these parts used to be taught. So then what is new in this MCI template? What we are calling it new MCI template. So what is especially added? Especially added is integration part. So now we will also, rather we have largely taught in isolation, even what is happening in other department, possibly in most of the cases, we have hardly bothered. But now alignment and integration is largely suggested, and it will really help. It will really help. So now look the competency table. So we are having, to start with, we are having number for each and every competency. For example, physiology, they have chosen the word PY for physiology. Then what we call system, they call it topic. For example, topic 1 is general physiology, and then competency number is 1. So for example, for first competency in physiology, the number will be PY, that is for physiology, 1 for topic, general physiology, and then first competency, so it has become PY 1.1. Suppose now this sub-competency is having 3 or 4 objective, the number will be PY 1.1.1, 1.1.2, and so on. This way we will number the objective. Then to write competency, which is already designed. Then as we discussed from old also, for each objective, domain will be decided, competency level will be decided, core or non-core, that will be decided, suggested teaching learning method, different objective of different domain may require different effective teaching learning method, so as assessment method. And now we are also focusing to enhance skill training. So some practical, which are most important, for example, blood pressure measurement in physiology, respiratory system examination in physiology, they are said to be, or they are carried to highest show-how level or performance level. This means till a student will not perform independently in front of us, we will not log that practical, we will not sign that practical, and number of attempt are also written. For example, in some practical, suppose number is written 2. This means that a student should perform twice in front of us independently. We may need to give more rotation to that practical. So suppose we have given blood pressure 1 or 2 rotation in which he has learned. Now in next rotation, again blood pressure. And we will ask that you have already learned. Now you try to perform twice in front of me. I will not speak anything. Then and then I will log your practical. Then and then I will sign it. And these are the most important practical. So this to enhance skill training. And then the integration, vertical integration, horizontal integration. In fact, all these curriculum, they are designed earlier, and alignment and integration module actually came little later. So there is a further division of integration and alignment, and 4 type of integration has been suggested, but that will be a separate topic. So nesting, sharing, and all that, but vertical integration and horizontal integration. So possibly what is being added is this certification for most important skills, and these integration part. Otherwise, even this competency table is also what we used to learn previously as well. So these are different components or 11 components. You can see once again. So always and always, framing SLO is first step. It is beginning. So what we need to do now is to form SLO by looking at our subject specific competencies. Our first step is to frame SLOs. Once SLOs are made for each and every SLO, we will look forward for all these things. This SLO is having which domain, core or not core, what is the competency level, what can be the appropriate teaching learning method, what can be the appropriate assessment method, can we do horizontal integration, can we do vertical integration, if it is a practical which is labeled as P, then how many certifications are written. If it is 2, he has to or she has to, student has to perform twice in front of us before we will log it, before we will assign the journal, and even a portfolio may be thought of. So this was our next session. It's beginning, it's the first work for us. This was competency level Miller pyramid, not new for anybody. So competency level for each objective we select. If it is just a knowledge, no, just it is on knowledge application, describe or how or why it is know how. Then for practical we write show how, but possibly even show how can have 3 parts: simple skills, show; little complex skill, show how, and here somewhere we can put performance. So performance level is somewhere here, and then does level is basically that student should perform that competency effectively in society without observation. So in medical teaching everything is controlled, so we cannot go up to this level. But then most important practicals, we can try to come as close as does it is possible. जितना 10 के पास आ सके हम important practical में उतना अच्छा होगा. So for most important practical, we want to come closest to 10, and that's why they have labeled P. So for P practical, we will give special emphasis. For each and every objective, we can think which alignment and integration suggested, 4 are suggested, we can select to enhance learning. So this was Miller's pyramid. On the basis of that competency level, we decide for each and every objective. It is just, I have written this, you can say, so that all components, again, you can see competency table is having these 11 components. It is having competency number. It is having then the competency already decided number and this is what we are supposed to start with to make objectives. And for each objective, they have done, MCI academic committee has done this for competency. We will do this for each and every objective. So for each and every objective, we will select all this. For example, one objective is apoptosis, and we have made 4 objectives of apoptosis. Then for each of those 4 objectives, we will write all these from 4 to 11. This objective is having which domain out of K, S, and ATCOM, which competency level out of know how, show how, and D is not possible, maybe P, whether this objective is core or not core. For example, apoptosis definition, physiology, pathophysiology can be core, but the difference between apoptosis and necrosis, this may be a non-core in first year. Appropriate teaching learning method, appropriate assessment method, and if it is labeled P, that practical is labeled P, number of certification required, and then we can think of which alignment and integration is possible. So just I have put it horizontally so that in one frame, because of font, it can be clearly seen. Otherwise, our table is basically in other mode. So this is one example. For example, if we say blood pressure, this is competency number. We can see is that it is physiology, 5 is topic number, system number 5, and it's competency 12. And this is competency given by MCI, and this we have made this SLO by selecting all the component and checking it is smart or not. We have selected domain, so this is skill domain SLO. We will select competency level, so they show how competency level, in fact highest level of show, that is P. Yes, of course it is a core. Then what teaching learning method, so practical by practical, DOAP, or nowadays what is being taught in revised basic or CISP. We can use Peton model also. How we will assess, maybe OSPI, maybe practical exam. Number of certification written is 1. This means even after practical class is over, we will ask student to perform once this practical independently in front of us. We will not speak anything, and he should do it perfectly. Then and then we will sign the journal, then and then we will log it. So number of certification required, it may be 2 also in some practical, means twice it need to be done. Then vertical integration, yes, we can talk about hypertension. That is a part of medicine, a little bit with this when we are teaching this. So vertical integration, yes. Horizontal integration, maybe no. So for this SLO, we have done all. So each and every SLO we will frame out of competency. We will fill everything starting from domain, competency level, core, non-core, teaching, learning, assessment. If P, then number of certification, and then integration. Integration is of course new for us, so that in that direction we should definitely think. So that is needed for us. So take home message, competency say SLO banana hai, or as per SLO, each and every competency or headings given in competency table need to be filled. So we are looking to the future, bright future for our students. That is competency based medical education. This is for highlighting, because everything is okay for us. Integration is not that much easy for us. We are habitual of
Hello.
hello.
Dr. Neeraj. Dr. Neeraj.
Time is over.
हाँ,
हाँ.
Dr.
Okay,
Chinmay
so
here.
this is the last slide.
Hello.
Last slide है वैसे.
You can no. You please continue, because it is already 45 minutes. So I am thinking that, as we also think that student cannot bear more than 45 minutes, we will keep the remaining part 2 in the next week only.
As
So
Dr.
we will
Chinmay,
continue.
I am declaring this is the last slide, and just look, one brick may not be that useful, but if the bricks are aligned, they make a wall, and the wall is so useful. It makes the house. So मिले जो कड़ी कड़ी एक जंजीर बने. So alignment and integration is needed. मिले जो कड़ी कड़ी एक जंजीर बने, प्यार का रंग भरो, जिंदा तस्वीर बने. Thank you so much. Over to you, Chinmay.
Okay, thank you, sir. So what I'm thinking that now we can go for question answer session. Uh, uh, what Because the thing is, there may be many query in this part also. So I think we can open the floor for question answer session.
Chinmay sir, there are already a lot of questions on the panel from the participants.
Yeah, the first
there are
question.
3 questions which I'm actually seeing.
Yeah. How do we
Can I-
demarcate between SH and P competency, Dr. Neeraj?
P competency are already written as in that column that this competency is P. This means consider it performance, consider it closest to does. So this and then number of certification will also be mentioned against where P is written. So as I said, these practicals should be regarded as most important practicals, and student need to perform in front of us. So let's consider it highest level of show how nearest to us. What we can teach. He will independently perform in front of us to get certification.
Okay.
Other
We have
questions?
one. Yeah, we have one hand is from Dr. Amrutha. I am unmuting her. Yeah, Dr. Amrutha, you can unmute yourself. Dr. Amrutha. uh, uh, there is a one question. What do we mean by horizontal integration?
Or we can do ask a question in chat room.
What do we mean by horizontal integration? That is one question. Second
So
question
there
is
is
how to have a uniform method of certify the procedure.
uniform. Okay, first is horizontal, so that we all know that integration in the same phase, same year. For example, if we integrate between anatomy and biochemistry, it is horizontal. But if we integrate with pathology and medicine, it will be vertical. So this is one. And second question is
How
there
to have
uniform
uniform
method
method
of
to certify the
certification?
procedure? Yes, to certify the procedure.
No, we have to use our subjectivity here because once we are convinced that he is taking the blood pressure or whatever practical P is written, that is okay with his or her face, we can certify it. So beyond that, it is subjective also. If we are satisfied, up to the satisfaction of teacher.
Then question is, please elaborate on core and non-core.
So as I mentioned one example also, if you think that this part of say competency or these 4 objectives are made and out of these 3 objectives are should compulsorily, for example, anemia is a core part. For example, say pheochromocytoma. So pheochromocytoma mostly will hardly a student will see in his or her life. So we can carry it into non-core. For example, physiological effect of meditation. This competency even MCI has labeled okay non-core type. So must know part is core. Nice to know additional part is non-core.
Dr.
Okay.
Chinmay?
See, there are other questions which we are going to deal in detail in coming sessions, like sharing nesting. So I'm not taking that questions.
Yes, in integration.
Yeah, so that we are going to discuss. So I'm not taking that questions right now. Okay. Any other questions regarding certification or your task, group task?
Dr. Chinmay,
Yeah.
Dr. Hasmukh here.
Yeah.
Can I speak one thing?
Yeah. Please.
Regarding certification, as the question raised by Amruta or whatever the name of faculty regarding the certification. Okay. So here regarding the certification, one example, measurement of the blood pressure, how to certify it. Okay. So here for that, we can make the methodology very clear. We can make the various steps of the methodology. Suppose we are taking exam by the OSPI method. Okay, so here we make the methodology in a structured way and we check each point of the methodology. Suppose for the recording of the blood pressure, proper sitting of the patient, precautions taken prior to blood pressure measurement, okay, relaxation for the 10 minutes, empty the bowel and bladder, no tea, coffee. There are so many points, and on the basis of all these points, how they tie the Rivarosic curve, how they raise the mercury, how it inflate, how it deflate, and by looking all the points, we can certify this competency, and we can give the certification. So here the best way to make it very structured for each methodology step in practical, make it very structured because this is the one skill and it is the lifelong skill. So here on this basis we can give the certification. Okay, thank you.
Yeah. So the thing is, yeah, actually we have one more session, total session on logbook and certification. So we are going to discuss each and everything in more detail. When will be the there is one question. When will be the introductory session for the faculty? Please let us know. How many chances we have to give for a skill? So that all we are going to discuss in certification. So I request all of you to just go through the presentations or video we have said after last session, and let me again share with you the different topics which we are going to cover because there are few faculty who have joined after our last session is over. And so I'm just sharing my screen right now, so you can see what are the topic we are going to cover. So now can you see that these are the topics we are going to cover in coming days. So today actually we have completed explanation of MCI competency table. Why we thought to combine two sessions? Because we were thinking that you can start your group work of framing objective, but as it is going very nice and beautifully, and we don't have any much hurry, so we will go week by week. So meanwhile, what I will suggest that all of you please download the competency table uh, so that you can just go through it. And next session will be by Dr. Masangi madam and Dr. Swapnil in regards to how to frame a competency. Now today I have also shared, as few of you might not have uh, gone through the presentation, so or audio. So I'm telling we have shared it on Google Classroom also. So can you see this Google Classroom? So those who have not joined, please join this Google Classroom using this code. So you will get all the audio and all the recording in this Google Classroom. So if those who are first time, let me explain in just one go, that if you are first time for the Google Classroom, click classroom.google.com, click on the plus button and click on the join class. And when it is asked you to join the class, you have to insert the code which I have just shared. I am again sharing that code. Okay, so let me see any questions now. There are few hand raised. Dr. Vadwani sir, unmute yourself.
Hello.
Yes, sir.
Sir, I have a question especially regarding the competency table of the endocrine. Hello.
Sir, yeah, please repeat your question, sir.
My group is allotted competencies of the endocrine part,
Okay, sir.
and in that that numbering is very much not proper, because we generally taught that what are the general rules of functions of endocrine mechanism, that, and that is coming in the last one, and many endocrines are jumbled together, like your pituitary, pancreas, and that functions of all of them are jumbled together. So we have to
Sir.
form the sub competencies.
Yes, sir.
Competencies we can
So
have
it is.
feedback and
Hello.
Yes, Dr. Neeraj. Yes, Dr. Neeraj, please respond.
yes,
All
look,
things
this is
are
the first.
in one.
Yes, sir.
And there is also unnecessary function test jumbled together of the pancreas and thyroid, and that all together.
So, sir, actually, look, these are the first time we have made subject-specific competencies,
Yes.
and this is unique for our country. So, this was the first
Yeah.
and very excellent attempt. But whatever feedback all faculties are feeling in this
Yeah.
course, also we can keep on collecting those, and we
So
can
we
have our
can
feedback.
sit together and break it.
Yes.
We can sit together and break it and rearrange it.
So yes, of course, we can keep on collecting the feedback on competencies, and that also will be a one important part.
And sir,
Yes,
one
yes.
more thing, at your university level, you can break it and you can make your own way,
Yeah,
curriculum
yeah.
of your university.
Because
It's
we
the
are
whole
taking 10 to 13 lectures and it's separate for the stress and separate for the growth also.
yes, yes. One more thing,
So
sir.
that
Your
has to
time
be
is
included
not so. Look, sir,
separately.
for one competency, for one long competency, you can take 2 or 3 lecture or 4 lecture. It depends on you. You can break it.
Okay, okay. Thank you.
Okay, thank
So
you, sir.
let me
Welcome,
share.
sir. Madhvani, sir.
Yeah,
Thank you.
let me share with all of you
Yeah.
that this is a live document, as mentioned by MCI also, that whatever
The,
competencies are available, this is the live document, and we are fortunate to have Dr. Hasmukh with us, so we will share feedback with him also and to MCI also as a whole once our this course is over. And so this course we can say this is a platform course is one we can say कि ये तो एक बहाना है कि हम सब मिल रहा है लेकिन using this platform of this course we will all will sit together and we will have something concrete which we all can utilize afterwards in next year.
Yes,
okay,
and it
thank
is
you.
Dr.
united.
Mahajan, yeah, Dr.
Can also
Mahajan, one
speak.
question to you: how to motivate
Yes.
people to go as per the CBME? How to motivate people?
No, we all want to become a good teachers and want to do maximum. I will say is that why our students are going to dams and all that. We want that they should come to our classes also. So actually, we should be highly motivated and do best for our this. And this is a great platform because we will come to know what is happening pan India. Otherwise, we are hardly having, just we are having some chat during examination. In our college, this happens. In our college, this happens. Now, this is the platform when we are talking in depth what is happening anywhere in the India. So, this is itself is so motivating.
Any other question? I have already shared the audio which is shared by Dr. Neeraj in Google Classroom also. So you can get it both the thing in WhatsApp as well as from Google Classroom.
Thank you.
Now there is a few Dr. Tejaswini. I want to ask something. I have unmuting her. Yes, Dr. Tejaswini, you can please speak. Okay. Dr. Suchitra, please unmute yourself. You are self-muted. Dr. Suchitra. Yes, you can speak now.
Voice is coming.
Okay, I think there is some problem on her side. She is not able to speak pro. Yes, Dr. Suchitra. Ma'am, your voice is breaking. I request you to just put your question in
voice
either
is not
WhatsApp
clear. Yeah, Dr.
or
Chinmay.
chat box. Dr. Suchitra, we are not able to hear you. Either you can put your question in WhatsApp or in the chat box. I think there is no more question, and there are few questions by other people. Oh, please, ma'am, please mute yourself. This is creating too much noise. Okay.
Dr. Chinmay,
Yes.
I'm Dr. Hasmukh. There was lots of crackling sound.
Yeah, that was from one of the participants, so she has muted herself. Okay.
Okay, look,
So I
one more
think,
thing. They can ask questions personally, okay, or in our WhatsApp group. We will answer.
yeah, okay. I think there are no more questions here, and I request, and I will also post for, let me share you with all again the topic which we are going to discuss in future. So that will be discussed in detail. So I am sharing my screen. That these are the topic which we are going to cover. Okay. So for this week, every group will prepare their basic document of introduction of all their group members, as well as download the competency table from the MCI, and you can just frame your objective on your own, but it will be taken in detail in the next week by Dr. Mathangi and Dr. Swapnil. And Dr. Neeraj, please share that audio again, as a few people have missed it.
Yes, sure. I am here only.
Okay, so please share that audio again. Yeah, there is one question that will it not be better if the SLOs are also made common for all? So, ma'am, actually, we are with this course, we are planning to do that only, that we all together have a burden of only preparing SLO of 5 competency, so we can have a full concentration on preparing a competency of competency and SLO of only 5. So we will be able to do it properly, and as shared in first and second session, we are preparing this document, and we will see that it will be used by all over India. So I think there is no more question, so I'm closing the session, and we'll be sharing the recording or link of the same by tomorrow morning. Thank you all. Have a nice day. Good night. Thank you, Dr. Neeraj and Dr. Hasmukh, for a wonderful treat.
Okay, thank you so much.
Thank you. Thank you all.